The good news about migraines today is that we know much more what is migraine.
While both men and women suffer from migraine, women are 3 times more likely to experience migraines than men. Globally, 1 in 8 have migraine.
From the patient's perspective, an acute attack is a pain that starts somewhere in the head and neck area and progresses, usually predominates on one side of the head, and it tends to have a pulsating quality, almost like a beating heart. There's also many associated symptoms such as nausea, vomiting. Patients can become very sensitive to light and sound.
While it may be well understood that migraines have a negative impact on patients' quality of life, the extent of that impact is underestimated. Migraines impact every aspect of a person's life, including friendships, relationships with significant others, relationships with children, employment, mental health, and much more.
Patients will often say that during a migraine attack, they have to stop doing whatever they're doing, go into a dark room and lie down for the most part. So they miss out on many family activities, work-related activities, school-related activities, and this has a significant impact on their quality of life.
Acute treatment aims to reverse or at least stop the progression of a migraine that has started.
So the Canadian Headache Society came out with guidelines a few years ago, and they made it very clear that the goal was to reduce headache pain rapidly and efficiently so that people could get on with their lives.
Key to effective management of an acute migraine attack is early recognition and early treatment.
So when I see a patient for the first time, to help them understand the importance of treating their migraine early, I always give the analogy of a fire in their kitchen. So if they came in, they saw a fire burning, what would they do? They'd react very quickly and they would try to put out that fire as quickly as possible to minimize the damage. This is the exact same approach they should have with their migraines. So they need to take their abortive medication very rapidly at the first signs of their migraine and then repeat the dose approximately 2 hours later if they have any residual symptoms.
Abortive or acute treatment begins with NSAIDs. Examples of NSAIDs are aspirin, Advil, and Aleve, available over the counter, or Cambia, available by prescription.
So the Canadian Headache Society guidelines are organized according to the strength of the migraine. So by definition, migraine is a moderate to severe disease, but the headache starts out mild. So in the mild condition, you always want to start with non-steroidal anti-inflammatory drugs, or NSAIDs. And if those do not work and the migraine becomes moderate to severe, then you would want to either add on a triptan or use a rescue medication such as an anti-nausea type medication. But we always start with non-steroidal anti-inflammatory. If a patient were to ask me if all non-steroidal anti-inflammatory drugs were equal, I would actually tell them that the mechanisms of action differ somewhat. But what's so important, what differentiates most of them, is how quickly they work. And by far, the non-steroidal anti-inflammatory that works the fastest is diclofenac potassium solution, or Cambia, and that's why it has been improved by Health Canada for migraine, and compared to the other NSAIDs that take a little bit longer to act.
Many people believe that the nausea and vomiting that often accompany migraine attacks may be caused by gastric stasis.
Gastric stasis is a phenomenon that we see in migraineurs, especially when they have nausea. This is important for a migraineur. It will help them choose their medications. Patients that have predominant nausea, we know they have important gastric stasis, and therefore will choose medications such as injectables or liquids that will be better absorbed. I think the most important message that I could leave for a migraine sufferer today is the importance of being implicated in their care. It's very important to get involved with your care, understand migraine, and work with your physician to achieve the best results.
To learn more about acute migraine, please speak with your doctor or visit the website below.